Hello everyone, Andrew here. Today I'm going to be talking to you about toothache and ways that you can manage that if you're not able to get to the dentist straight away. Now, of course, if you have pain, if you have any swelling, if you think you have an infection, or if you have just concerns about your teeth, you should try and see a dentist if and when you can, but that may not always be possible, and that may not always be possible straight away. So I'm going to give you a couple of little ideas and a bit of advice as to what you can do if you are in pain, if you have concerns. When we talk about toothache, there are different types of toothache, there are different types of pain that you can get within your mouth. I'm going to talk about some of the main issues that you can present with, that you may experience. The first thing to talk about is more sensitivity. So you may not kind of class this as pain. It's a kind of a short, sharp discomfort, a short, sharp pain maybe. As I said, you may describe it as a sensitivity rather than the pain. It may almost feel like an electric-y feeling, an electric shock, and that will often happen with hot or cold. Maybe if you breathe in some cold air, or if you have a cold ice cream, or if you have a particularly hot drink, and it may also happen with sweet things. Now, that can be just a sensitive feeling. It may be that the gum has shrunk back around a tooth, exposing a little bit of the sensitive root. So just a slightly sensitive area on the tooth has been exposed, and it could be that the tooth is essentially healthy otherwise, but it's just had a slightly sensitive area exposed. When you get this feeling, it could also mean that there is an issue with the tooth. It could mean that there is a hole, or the start of a hole, start of toothache. Ways to manage this, of course, when you can, if you have concerns, try and go visit a dentist. In the meantime, using something like a sensitive toothpaste can be really, really helpful. And what you can do is not only brush your teeth with the sensitive toothpaste. When you're brush your teeth with the toothpaste, spit out, but don't rinse with water. That leaves a little bit of toothpaste on the teeth, which keeps protecting them. But what you can also do is take a little bit of the sensitive toothpaste, just a small amount, and if you know, or if you can feel a particular area that is sensitive, just rub it onto that sensitive area. Now the next pain or discomfort we're going to talk about is maybe the kind of, really the step on from that sensitivity. It may be that when you have something hot or cold, you get that short, sharp, electric-y feeling, but maybe it's lingering, it's hanging around for a while. That will almost always indicate that there is an issue with the tooth, and it could be that there is a hole in the tooth. It could be there is some decay within that tooth. Essentially what you're feeling, if you're getting that hot, that feeling, that kind of sharp feeling with hot and cold, then it's lingering, and it might not be for particularly long, it might just be for a couple of minutes. That will tend to mean that there is an issue with the nerve of that tooth. Maybe, as I said, because there has been previous treatment because of previous decay, or there is new decay, there's a new hole within that tooth. Again, sometimes patients will find that using something like a sensitive toothpaste will just dull that feeling slightly. If you can tell whereabouts that pain is, trying to keep that area as clean as you can is great, and also trying to chew away from that area. Now, quite often with these pains, in the early stages, it can be quite hard to identify which tooth or even which area of your mouth that pain is coming from. Quite often patients will find that they can't tell whether it's a top tooth or a bottom tooth. Again, going to see the dentist when you can. However, if that's not possible, trying to manage the symptoms with painkillers as best you can. And as I said, keeping those areas clean, using a sensitive toothpaste, and trying to chew away from those areas is a good way of managing those symptoms while you have them. Now, again, kind of moving on and kind of moving up in terms of severity and pain that you may be experiencing. If you're experiencing a throbbing pain, and it may be that the throbbing pain comes on after you've had the hot or cold, some type of stimulus, maybe chewing or brushing, something has set off that throbbing pain, that will almost always indicate that there is inflammation within a tooth. It may be that a tooth is going through the process of dying off because of either previous treatment, or again, maybe there is a new hole, there's a large cavity that has developed in that tooth. I'm going to lump this in with throbbing pain that maybe is just kind of constant or is coming on its own. That's more likely to be caused by an infection. And essentially, any throbbing pain that you get within your mouth, it's likely at this point that it's starting to localize itself more to a particular tooth. You'll be thinking, okay, now that pain has moved on and I can tell, actually, yes, it's this tooth. If that is the case, there are several ways that you can manage it. Again, coming back to what I said previously, of course, if possible, you need to go and see a dentist and get their advice. A pain like this, a throbbing pain, is a build-up of pressure. So a build-up of pressure which is either being caused by inflammation within a tooth or an infection, bacteria getting in, around or underneath a tooth, causing a build-up of pressure. Ways to manage that. If you cannot get to see a dentist, it may be that a dentist or a doctor can advise you, and it may be, and particularly if there is a visible swelling, that a doctor or a dentist can prescribe you some antibiotics. It tends to be, if you're okay with this type of medication, that something like an amoxicillin, a penicillin antibiotic is very good in this situation. If there is no swelling or no obvious infection, it may be that there's no benefit to an antibiotic. In that situation, in the meantime, before you can get treatment with a dentist, the best thing to do is to use painkillers to try and manage the pain. The ideal painkillers for toothache are actually things that you can get over the counter. So there are prescription painkillers which can be prescribed to you by a dentist or a doctor, but actually the painkillers which most patients find the most effective will actually be the things that you can get over the counter. And the two things that you will find most effective are paracetamol and ibuprofen. Of course, you can only take those if you're medically fit and well and you're okay to take those, and you're not taking any other medications which are going to contradict or contradict those painkillers, or the painkillers are going to interfere with those. So as long as you're safe to take paracetamol and ibuprofen, those tend to be the absolute best painkillers for toothache. They can be taken together. Always make sure, as I said, that you're safe to take that medication, and make sure that you follow the instructions on the packet as to how many tablets you can take at once, and make sure that you don't exceed the daily dose. It will be stated on the packet. Paracetamol and ibuprofen will sometimes come in different strengths, so different tablets or capsule sizes. So make sure that you know the strength and the number of milligrams that you're taking at once, and make sure that you're never exceeding the dose. What you can do with paracetamol and ibuprofen, when the pain is really severe and it's throbbing, it's hanging around, it's lingering, what you can do is, first off, take a dose of paracetamol and take whatever it recommends on the packet. And most of the time on the packet with paracetamol, it will recommend you can take a dose every 4 hours, up to a maximum within 24 hours. So once you've taken the dose of paracetamol, it's 4 hours before you can take those again. Now, that may feel like a really long time if you're in severe pain, if you have a really, really severe toothache. So what you can do is, once you have taken the paracetamol, you've got that 4-hour window that you can't take any, and you may find that after 2 hours the pain is starting to come back. It may be sooner, hopefully not, but maybe within 2 hours you're starting to feel, okay, this toothache is starting to grumble again, it's starting to return, that pressure is starting to build up again. What you can do in that scenario is, that's the time, 2 hours after you've taken the paracetamol, that's the time to take the ibuprofen, as I said, as long as you're safe to do so, as long as you're medically fit and well, and you have nothing in your medical history that prevents you from taking things like ibuprofen. So you've taken your paracetamol, 2 hours later you may feel the pain coming back. If that's the case, take the dose as prescribed on the packet of ibuprofen. Again, similar to paracetamol, what you'll find is that most of the time on the packet it will say that you can take ibuprofen, the recommended dose, you can take it every 4 hours up to a maximum dose within 24 hours. So again, you have that 4 hours that you're not allowed to take ibuprofen for, but in 2 hours time you're going to be allowed to take your paracetamol again. So you're not taking paracetamol more than once every 4 hours, but you're having painkillers every 2 hours, as I said, up to the maximum dose that you can take within 24 hours. So you're essentially alternating them. So, and again, following the instructions on the packet, making sure you're safe to take this medication. Paracetamol, take the dose as prescribed on the packet. Ibuprofen, take the dose as prescribed 2 hours later. 2 hours after that, it's now been 4 hours since you took paracetamol, so you can take some more paracetamol, and then 2 hours after that, again, it's been 4 hours now since you took ibuprofen, so you can take some more ibuprofen. So you're alternating, you're following the instructions on the packet, you're making sure you don't exceed the dose as prescribed on the packet, and you're making sure you're not exceeding the maximum dose within 24 hours. But what that's allowing you to do, by using paracetamol and ibuprofen in combination, you're getting to take painkillers every 2 hours. That will hopefully keep you going long enough that you can manage until you can see a doctor or a dentist. If you have a swelling, as I mentioned earlier in the video, that will tend to mean that there is an infection. If there is an infection, antibiotics will be helpful. Until you can get them, painkillers will be really, really helpful. With things like amoxicillin, so the antibiotic I mentioned earlier, what you can do is you can take those. Again, there's no problem taking those alongside paracetamol and ibuprofen. Make sure you take advice from the doctor or dentist who is giving you any of these medications. Speak to the pharmacist as well when you get the painkillers, if they can advise you anything further. Unfortunately, there's not many great home remedies for things like toothache, but hopefully, as I said, those kind of straightforward, those bog standard ibuprofen, paracetamol, those normal over-the-counter painkillers will be really, really helpful. Get to see the dentist when you can. Of course, that's not always possible. If you have a swelling, something like antibiotics may be helpful, may be appropriate. You of course need to speak to the doctor or dentist or whoever is prescribing those for you to make sure that, again, you're safe to take any antibiotic that they're prescribing. Metronidazole is the other antibiotic that is quite often prescribed for dental issues. The big thing with that, there are interactions with some drugs, so you need to be very careful, and if you are taking any prescription medications, metronidazole may not be appropriate for you. The other thing with metronidazole is that it does interact with alcohol. So if you are put on a course of metronidazole antibiotic, you need to avoid alcohol during the course. And take advice from your doctor or dentist or pharmacist, but I would say you also want to avoid alcohol for at least 48 hours after you have finished the course. If you find that you have a dental swelling which is growing, which is spreading up your face, which is starting to close or occlude your eye, or you're starting to feel that you have your vision is changing, you're having double vision, you must go to accident and emergency, you must go to hospital straight away for emergency treatment, because if a dental infection is spreading up your cheek, it can sometimes affect your eye, and that can be quite serious if not treated promptly. The other thing to mention, if a swelling is maybe under your jaw or around the back of your mouth, like maybe something like a wisdom tooth infection, if you find that again you're having real trouble swallowing, or if you feel like you're having real trouble breathing, again, that is an emergency. The swelling, the infection is spreading and it's having an effect on your throat, on your airway. That is of course an emergency. If you have a dental swelling, or if you have any swelling which is spreading in that way and is starting to occlude your airway, you must go to hospital or accident emergency straight away to get urgent treatment. That's a lot of rabbiting from me. Sorry that video is a bit rough and ready, but I just wanted to get that out there as quickly as possible. If you have any questions, please comment below. There are lots of useful articles, information, resources on the Online Dentist website, so please visit that. If you'd like further advice, you can send us an email at info@online-dentist.co.uk. Please send us an email or leave a comment below, as I said. Visit our website if you'd like further advice or would like to get in contact in another way. There's a contact form there as well. Our website is www.online-dentist.co.uk. So www.online-dentist.co.uk. Yeah, please do get in contact. If that was useful, please let me know. Yeah, as I said, sorry it's a bit rough and ready, but hopefully that's been helpful.